The listening part of Occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Brian Harris. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. What's your problem?
Well, last year I had a traumatic injury to my left posterior. I got hit from a boat while I was in the water. I immediately rushed to the hospital where I had to undergo surgery. I'm still having an external fixation on the wound for healing fractures in the leg. I had undergone grafting and full-thickness skin grafting close to defects in my posterior thigh. It is almost healed right in the gluteal fold on the left area. In several areas along the graft site and low in the leg, there is several hypergranulation tissue developed.
Is there any bleeding from the wound?
No, doctor.
Okay, what's your age?
42, doctor.
Do you drink or smoke?
No, doctor.
Had any other illnesses in the past?
Nothing other than Clostridium difficile in the recent past.
Are you taking any medication?
I'm taking Cipro and Flagyl.
Are you allergic to any medicine?
No, doctor.
Any illness history of family members?
My maternal grandmother had pancreatic cancer. My father had prostate cancer, and he has heart disease and diabetes.
Well, your physical examination results are perfectly okay. Cardiology reports are regular. There is no S3, S4 or gallop. There is no murmur. Abdomen is soft. It is non-tender. There is no mass or organomegaly. Your right lower extremity is unremarkable. Peripheral pulse is good. Your left lower extremity is significant for the split-thickness skin graft closure of a large defect in the posterior thigh, which is nearly healed. Hypergranulation tissue both on your gluteal folds on the left side. There is one small area right essentially within the graft site, and there is one small area down lower on the calf area. There is an external fixation that comes out laterally on your left thigh. The pin sites look clean. There are several multiple areas of hypergranulation tissue on the left posterior leg associated with a sense of trauma to your right posterior leg. I would recommend a series of treatment with chemical cauterization of these areas till these are closed.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Thomas Andrews. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, doctor.
Good morning. Have seated. May I know your problem?
Well, I'm a patient with hypertension, chronic intermittent bipedal edema, and recurrent leg venous ulcers. I had a vascular surgery for non-healing right ankle stasis ulcer. I have a serious concern today that I had a low-grade fever of 100.2 early this morning. Otherwise everything was well. The thing is, I was not even aware of the fever. I do have some ankle pain, worse on the right than the left.
Okay, what's your age?
52, doctor.
Do you drink or smoke?
No, doctor.
Are you getting nausea, vomiting or diarrhea?
No, doctor.
May I know your previous illness history?
Well, hypertension, exploratory laparotomy in 2016 for abdominal obstruction, cholecystectomy in 2017, chronic intermittent bipedal edema, venous insufficiency, chronic recurrent stasis ulcers.
What medications are you taking?
Primaxine, daptomycin, clonidine, furosemide, potassium chloride, lisinopril, metoprolol, ranitidine, colace, amlodipine, zinc sulfate, Lortab, multivitamins with minerals.
Are you allergic to any medicine?
No, doctor.
Well, the physical examination shows heart rate 73, respiratory rate 20, blood pressure 104/67, temperature 98.3, and oxygen saturation 92% on room air. There is hyperpigmentation involving distal calf on both legs. There is an open wound on the right medial malleolar area measuring 9 by 5 centimeters with minimal serous drainage. Periwound is hyperpigmentated with a hint of erythema extending proximally to the medial aspect, distal third of the right lower leg. There is warmth, but minimal tenderness on palpation of this area. There is also a wound on the right lateral malleolar area measuring 4 by 3 centimeters. Another open wound on the left medial malleolar area measuring 7 by 4 centimeters. Wound edges are poorly defined. Laboratory results show white blood cell count is 5.8 with 64% neutrophils, H&H 11.3/33.8, and platelet count 176,000. BUN and creatine 9.2/0.52, albumin 3.6, AST 25, ALT 9, ALK-Phos 87, and total bilirubin 0.6. Chest X-ray shows chronic bibasilar subsegmental atelectasis, likely related to elevated hemidiaphragm, secondary to chronic ileus. No absolute findings. You have multiple previous wound cultures positive for Pseudomonas, Enterococcus, and Stenotrophomonas. Fevers, right leg, ankle cellulitis, chronic recurrent bilateral ankle venous ulcers, hypertension. I am ordering 2 sets of blood cultures, injection with daptomycin and Primaxine 4. I am ordering an MRI of the right ankle to check for underlying osteomyelitis. Follow-up results of wound cultures. Additional treatment and medications are upon follow-up.
That is the end of Part A. Now,